All right. Seems like we've all settled in the Zoom call pretty neatly. And to everyone on the Facebook live stream, hello. So before we continue, I'd like to congratulate all the speakers for coming to this debate. It is a great pleasure that students in the University of Manchester who care so much about contemporary issues such as the NHS are able to interact with people who not only have immense expertise and experience in this field. So in proposition, we have Miss Charlotte Buttercase and Miss Nell Karim, who will be presenting the proposition case for privatizing the NHS. And in the opposition bench, we have Mr. Jatinder Hayre and Dr. Tony O'Sullivan presenting the opposition case. Before we continue, I'd like everyone who is not a speaker right now to please cut your cameras off and mute yourself so that we can focus everyone's attention onto the speakers in question. Right. All right. Right. So this house would privatize the NHS. This is a public debate, but we are also we're fundraising for the Greater Manchester Mental Health Trust Fund. The link to the fundraising is on the Facebook post. After we hear all speeches from the speakers, we will open the floor in which anyone from the public could post questions onto the Zoom chat or on the Facebook post for the Facebook event. And then we will relay these questions to the specific speakers in question so that they can be answered. And this will continue on until the end of the event at 7 p.m. So just to lay down some ground rules, the speaking orders would go to the first speaker of proposition, Prime Minister, first speaker of the opposition, leader of the opposition, and then second speaker for proposition, and then second speaker for opposition. During the speech, the first 1 minute and the last 1 minute of the speech is protected time, in which the opposite bench cannot raise a point of information, which is a very short clarity or question to the speaker. They will be notified about the 1 minute mark and the 6 minute mark by a red post-it note like this. So, for example, when the Prime Minister starts her speech, I will raise the red post-it note after 1 minute, in which the opposition can start raising questions or POIs. And then after 6 minutes, I'll raise the red post-it note again. Now, before we commence the debate, I would like the speakers to introduce themselves to the audience and the audience in the live stream. So starting from Prime Minister and then up to the second speaker of opposition, could you just unmute yourself and introduce yourself to the audience, please?
Hello, everybody. Thank you for attending. My name is Charlotte Buttercase. I go by the pronouns she, her, and I will be the first speaker of the proposition this evening.
Hello, everyone. I'm Jatinder, and I'm a medical student. I go by the pronouns he, him, and I will be vociferously opposing NHS privatisation this evening. Thank you.
Hello, everyone. My name is Nahal Karim. I will be the second speaker for the proposition this evening. Thank you.
Hello, everyone. I'm Tony O'Sullivan, and I'm speaking second for the opposition to this proposition. Thank you.
Well, that was a very brief introduction of the speakers. Now, before we start the debate, can everyone except the Prime Minister close their cameras and mute themselves during the meantime? If you have a POI that you would like to raise to the speaker, I will raise the first red post-it note in which the opposition bench can start raising a POI, which continues until the 6-minute mark when I raise it again. So without further ado, the Prime Minister.
Thank you. So we, the proposition, argue that our modern day NHS is both outdated and inefficient and needs to be completely remodelled in the form of a privatised healthcare system, and this must be done in the name of adequate care of our British people. Our argument can be summarised thus. Firstly, we are seeing incredible increases in financial pressures on the NHS due to increased life expectancy and the unrealistic nature of a long-term government-funded system. This is resulting in greater patient suffering in the form of long wait times and missed treatment deadlines. And secondly, the poor treatment of our healthcare workers is impeding on the quality of the healthcare services that they provide. The current structure of the National Health Service neglects the basic living needs of these healthcare workers, and this needs to be addressed to properly care for the British people. We are seeing staff overworked, mistreated, and underpaid with little to no solution offered. I'd like to begin by proposing our definitions. We would define the National Health Service as the government-funded medical and healthcare services available to all UK nationals without paying for the cost of the service. And in the name of protecting the welfare of all UK citizens, and not just the most privileged, we would propose the form of privatisation that maintains no costs at the point of care, which we are already seeing integrated into our NHS. This is done by outsourcing treatments to private organisations, and patients may not even be aware that they are being treated privately. We choose to use this model of privatisation because both we and the opposition fight the same side, the side of equity and adequate care for all the British people, something which our current NHS is failing to provide. The healthcare system in Canada is an ideal model to represent our proposal. It blends the American system for privatisation, in which patients pay and those who can't afford it sort into an unequal two-tier system of healthcare, and the desires of the British people, where we wish to maintain universal free healthcare for all. In Canada, all citizens pay taxes, and insurance is granted depending on profession, and this contributes towards all healthcare costs. If you do not work or contribute to the national economy, you are not granted free healthcare. Each province or state has its own healthcare plan, and each citizen is offered evidence of their eligibility via a government healthcare card. Now, of course, their system is not without flaws, and it is easy to see that this could be considered to be an ableist approach. Because what about those who are too ill to work, who are disabled, who struggle with their mental health? These are all plausible concerns, and we do need to factor in the appropriate provisions for these people who are just as valuable to our society as any other person. But to even begin thinking about discussing these kinds of detailed logistics, we need to stop condemning the idea of privatisation or structural reform in the NHS. We need to allow progression of this privatisation proposal through the British Parliament so that we can work on a bill that unites the values of the left to serve all citizens, regardless of income or identity, and the values of the right, implementing sustainable systems that aid and uphold our economy. Right now, people are suffering. There's the astonishing deprivation of our mental health services, and that's what we're choosing to fundraise for today, where the average wait time is an entire month. Do you know how detrimental that can be? Let's put aside politics for a moment and just get in touch with basic empathy. Do you know the emotional strength it takes to put yourself into therapy, to admit you have a problem, and then to be given such a long period of time before you can actually seek the help that you've been so proactive in finding? Can be so damaging to someone's health. And psychiatry is just one small aspect of healthcare. Think about oncology, the difference between starting your chemotherapy or radiotherapy immediately as opposed to in 2 weeks. That can be a huge difference. And if you take a moment to consider that, you realise how backwards it is not to redress the current structure of our health service. So the next layer of my argument comes to the treatment of our workers. It is astonishing that politicians have watched the NHS staff crisis develop to the point it is at currently without taking any form of action. I can just relay my experience as a medical student in my first week in the middle of a pandemic. Before I even started my first day even, we had a greater burden placed upon us, because despite the danger we may be putting ourselves in by continuing with face-to-face teaching, there is such a desperate need for doctors now that our training is more urgent than ever, and every day we have to implement new changes in order to continue it. Our current reality is more than 100,000 NHS staff vacancies, 1 in 11 of all NHS posts. There are very high levels of staff turnover, with large numbers of nursing, midwifery, and medical staff leaving every month in secondary care, community service, and general practice in particular. And those are chronically high levels of sickness, absence, and presenteeism. Add to this the struggles most NHS organisations are having currently with recruiting staff, and the picture becomes clear. This is a crisis, and it's threatening the ability to deliver safe, high-quality care for the people in our communities. Any other industry, increasing staff turnover, absenteeism, and difficulty recruiting would be red flags, warning of fundamental toxicity in organisational cultures. If the NHS were to be viewed as a business, it would be taken under new management, there would be a new business model introduced, and its customers would be better for it. But why don't we view our NHS this way? Inflammatory media. But our inflammatory media isn't just attacking the idea of privatisation, it's attacking the NHS as it stands. Here's a selection from our ordinary times before the pandemic. Hospital wait times at worst ever level. Is the NHS facing unprecedented demands? Operation delays, everything up in the air. Ambulance A&E delays hit 1 in 8. Hospitals, people on beds as far as you could see. So here is what's striking me. If we can see these issues, why does Boris Johnson still have to recite the 3 words, protect our NHS, in order to appease the British people, to say that he's having an adequate response to this pandemic? Are we really wanting to protect the NHS as it exists today, or are we actually protecting our right to universal free healthcare? I'd argue the latter. People don't want long wait times. They didn't stand on their porches every Thursday night to applaud underpaid, overworked staff in an unsustainable, publicly funded system. People want to feel safe in the knowledge that their government will care for them. And as our National Health Service stands today, people are dying because of our refusal to condone reform. Thank you.
Thank you, Prime Minister, for that wonderful speech. I would like to now invite the Leader of the Opposition to bring forward the opposition case. And just a brief reminder that between the first and 6th minute mark of a speaker's speech, you can raise a POI by simply opening up your camera. So without further ado, the Leader of the Opposition, please.
Thank you. Let me start by asking you, watching this debate unfold, where were you born? Where do you go when you're sick? Who looks after your family in their time of need? The NHS is there for us all, cradle to grave, with compassion and care. The NHS is every single one of us, founded of the people, by the people, for the people. Few things unite our divided society, a society so divided by politics than the NHS. So what exactly is it that makes our NHS so great? It's not some mystical quality. It's the fact it's a public institution. The NHS is mine, it's yours, it's ours. But there are folk out there who don't share these values and would rather see the NHS butchered and fragmented, sold off to private companies and predatory firms, without a shred of evidence of any benefit either. Yet despite their claims, our NHS still votes as the best healthcare system by the Commonwealth Fund. The NHS does have its problems that have arisen from privatisation. So let's start by discussing a favourite topic of the privateers, and that is the market. The idea that medicine is marketable and is a luxury is utter garbage, a total betrayal of the founding principles of Nye Bevan. I fundamentally believe that illness is not an indulgence, and neither is disease a damnation. In fact, it was in 1963 when the Nobel Prize winner Kenneth Arrow outlined the problems of marketizing medicine. The healthcare provider knows far more than the patient. You have a mismatch of information. Therefore, the patient has inadequate information to navigate the marketized system. This is known as the asymmetry of information. And you know what happens from then on? The patient is exploited on many levels. Ivan Illich went further and said vested interest in sponsoring sickness led to iatrogenesis, which means damage inflicted by unnecessary procedures and medications. Tell me, where do the pillars of medical ethics go now in this privatized system? They're simply bulldozed by the greedy, predatory private firms in their quest for profit. So we've seen the exploitive nature, but these private companies offer us nothing. The private sector is shambolically inefficient. The NHS is by and large, unequivocally, the most efficient healthcare system in the world. So without stumbling around, let's have a look at the numbers. We have the lowest healthcare expenditure per capita of the entire G7, spending just £2,989 versus £4,432 in Germany, and even more so in Canada. But the US, which is a completely privatized model, has a monumental health spending of £7,736, yet 28 million people suffer without any health insurance. So let's focus on the EU. A bit closer to home, a recent systematic review from across the European continent suggested that public hospitals are at least as efficient or more efficient than private hospitals. So why is our NHS better than a state insurance-based system? Well, it's simple. The NHS costs less to operate. There's more equality. There's more accountability, and it provides an incentive for public health gain. We're all on the same side. They're not fishing for profit. Now, this money I'm speaking about, let's cut to the chase. This is our money, yours and mine, that's being wasted on this privatization agenda. And what's more is that private healthcare is ineffective as well as inefficient. The private sector is skillfully manipulative at cherry-picking the straightforward routine cases, ignoring the more difficult ones. The CQC has even warned us of the destabilizing effects this will have on the NHS. And if we look at maternity in particular, one thing that we see is that this maternity sector demonstrates the callous morality of these private companies. Private hospitals will treat straightforward cases at inflated prices, normal deliveries in healthy women. But sick babies, preterm babies, and women with health issues are simply tossed aside. You're no good to them if you don't make a profit. This is what happens when you prioritize profits over people and commission over compassion. Luckily, there is an NHS out there that does accept anybody and everybody. And I fear what will happen if the rogue private sector profiteers from our misfortunes. But the most criminal aspect of private care is the horrific health inequalities festering beneath that glossy facade. Health inequalities are the worst of all. Knowing that your life will be cut short because you're less well off is terrible. Let's have a look at the ugly face of the US and the inequalities that fester. If you're Black, you will die sooner. If you're poor, you will die much sooner. If you're LGBT, you will die sooner. Your mortality from even simply managed conditions will be much higher, whereas your life expectancy will be much lower than any other comparable rich country in the world. This is what happens under privatization. Even the Canadian model previously mentioned shows there is huge regional disparity dependent on educational levels, deprivation levels. It's not an efficient healthcare system, and it's so dependent on the regions. Nye Bevan said a society can only call itself civilized if nobody is denied medical care based on a lack of means. I, for one, do not want to revert away from the civility of the NHS towards the carnage of a privatized system. But let's just remind ourselves, we've looked at the ugly, unfair, unevidenced nature of private care. But the NHS is personal to us, to every single one of us, to me, to you, and even those who oppose it. So I would like to end by discussing what the NHS means to me after discussing the evidence with you. As someone from a working class background somewhere in the middle of England, the NHS has been an absolute lifeline for people like me and my family. And unfortunately, the reality of life means you too will face malady and misfortune. But take comfort in the fact that the NHS will be there for you. So let's be there for the NHS. So I hope tonight you will join me and Tony in fighting to preserve the greatest marvel of our society. And that's our NHS. Thank you.
Thank you, the Leader of the Opposition, for that very fine speech. I would like to introduce the Member of Government, please. Oh, and before we start, I'd like to also remind that anyone in the public can raise any questions after all the speeches during the Q&A. Speakers can actually also raise certain questions to any other bench if they would like to. But without further ado, the Member of Government, please.
Good afternoon, good evening, wherever everyone is watching from. So I, like the speaker who came before me mentioned, illness is not a luxury and healthcare is not a luxury. So one of the major points that I would like to discuss today is rationing in the NHS and medical access to medical care that patients are not receiving because of through the NHS. When care is not funded on the NHS, doctors can use the exceptional cases system to appeal to their local clinical commissioning groups, the CCGs, to get treatment for their patients. This scenario is normally associated with drugs or treatments which aren't funded by the NHS, or when a patient's condition is not considered severe enough to qualify for NHS funding. This increases the bar at which a referral for an operation is made, and the NHS can restrict the number of people receiving the treatment through the system. The treatments here are not only cosmetics. It's not only, you think, well, it's probably about treatments such as cosmetic surgery or plastic surgery. These are not the only treatments that fall under the system. Other treatments include fertility treatments, cataract removal, hip and knee surgery, and of course, mental health care. Healthcare under the NHS is being rationed. And who is it being rationed to? What pseudo-technical illusion decides which patients are in enough pain, which condition is severe enough to be deserving of treatment? Severity of a condition, of course, is a subjective, value-laden guesstimate. Currently, decisions of such severity are made on recommendations by NICE, the National Institute for Care and Excellence, an organization that uses the measure of QALY, that is quality adjusted life years. And one QALY, of course, is equaling to 1 year in excellent health. This measure disadvantages people with disabilities, seniors, and patients with chronic conditions who cannot achieve maximum QALY scores because they will never achieve the highest quality of life. But who gets to decide what this quality of life should be? For someone who is not able to walk correctly, their optimum quality of life would be to have that hip and knee surgery. Increasing demand is one of the biggest issues faced by clinical commissioning groups. In 2017, 899 requests were made for hip and knee surgery, up from 49 in 2013. Cataract appeals numbered over 1,000. The total number of these special requests rose to over 73,900. Out of these, only about half of them were approved. So for patients who've been turned away from this universal system, privatization is the only answer left. Where else would they go to receive the healthcare they need? And when they are so desperate, who is going to regulate that and make sure that they aren't taken advantage of? I'd like to highlight one of the most successful healthcare systems in Europe and the world. Two of the most successful healthcare systems in Europe and the world. First one being Germany, where people are able to buy private health insurance, and this guarantees that they're given competitive rates by insurers. They receive all the best treatments that they can find, and most of all, they can access the treatment they need. Sorry, I won't be taking any points of inquiry. Secondly, in the Netherlands, private insurance companies must, in the Netherlands, people who opt for private insurance companies must offer core universal insurance packages that cover all primary care. And that includes costs of all prescription medicine, something not covered, not completely covered by the NHS. They must do this at a fixed price for all. The same premium is paid whether you are young or old, healthy or sick. It is illegal in the Netherlands for insurers to refuse an application for health insurance. The system is 50% financed by a health regulator, 5% by the government, and the remaining 45% by the patient. The regulator, they can oversee the claims made by policyholders, and they can redistribute funds. The insurers with high payouts, they receive more payments than insurers with low payouts. This incentivizes companies to not deter their high-cost individuals, patients who are likely to have more expensive healthcare needs, because they will be compensated for it. So what I want to say is quality of care isn't necessarily compromised by privatization. In fact, introducing this privatization offers options to patients who have been ignored by the NHS. Furthermore, the regulation of these private services can be continued by the government, such as case like in India, the private companies during the COVID pandemic have had a cap issued on them by the government of how far they can charge for treatments to patients where the public healthcare system is failing them. It's not a simple answer that privatization is the best, there's only one way of privatization. It is not, we don't have to follow a US model that is failing so many individuals. There is a smarter way to go about this. And if we're talking about universal healthcare for all, where everyone is treated and everyone receives treatment, not just those people who have conditions which are severe enough, we have to go forward, and keeping the NHS public is not that direction. Thank you.
Thank you, the member of government, for that very fine speech. I would like to introduce the member of the opposition, please. Before we continue, I also like to remind the audience that if you have any questions, which we will, when we open the floor, please enter them into the Zoom chat, or you could post a comment onto the live stream post. That way we can relay your questions to the speaker. Thank you.
Should I start?
Yes, the member of opposition, please.
Thank you. First of all, I'd like to sympathise very much with Manchester students who are facing the fear and isolation that you've suffered at the start of the new term under COVID. And I'm sad at the loss of a Manchester student in the last few days. Health care is a universal human right and not a commodity, and that underpins this whole debate. I want you to look at tonight's question through the prism of COVID. COVID is one of the worst challenges since the Second World War, and I want to use it to compare the wonderful response of the NHS to the worst failures of our politicians who responded by bypassing public health, local authorities and primary care, and have outsourced billions to the private sector, and they failed us. The Thatcher years were bad for the NHS up to the late 90s. In the decade, however, up to 2010, the NHS had been funded very well and was approximately at the European average. Then the NHS was regarded as the best health system in the world, with short waiting lists, prompt treatment, and A&E that you'd be seen within 4 hours by 95% of the time. Since 2010, government dual policy has been to underfund the NHS, public health and local government, and to promote private involvement. And it is this underfunding that has led to rising waiting lists and to the terrible treatment of NHS staff working under conditions where 100,000 vacancies exist. The government has outsourced more and more of NHS's clinical and support services, never more recklessly than during this pandemic. And the combination has left our NHS in trouble and the country in jeopardy. Now, most of this audience here were aged probably between 8 and 13 10 years ago, and you may only have known an NHS in trouble, especially in these last 5 years. But please note, A, that what the NHS is capable of when it's funded well and when the spirit is public service and not private gain. And B, it remains a great service now, despite the encircling private sharks, and it works. Under the NHS, everyone, this is unique in the world, everyone has access to a GP, even in this hostile environment attacking Black and minority ethnic community refugees. And hospital care remains almost exclusively a publicly provided service. And although savagely cut, local public health teams are still working hard and successfully. These factors have allowed the NHS to respond to COVID in an unprecedented way, redesigning hospital capacity, coordinating its services in the length and breadth of the country to put the safety of the public first. The NHS massively increased its intensive care beds and created COVID wards. It organised national research to look at new treatments, for example, new forms of providing oxygen therapy and dexamethasone treatment to share with the rest of the world, including, unfortunately, Donald Trump. And NHS and research bodies have cooperated to produce potential vaccines that offer a real way out of this crisis. Now, in contrast, in America, because COVID caused private work to plummet, profits were hit and private hospitals laid off thousands of nurses. Instead of being part of the national solution, private medicine added to the problem. Healthcare is a political issue and it's the political choice of government. The NHS faced the pandemic starting from a damaged position. 10 years of underfunding of NHS hospitals, primary care, mental health, public health and social care. And I agree with the other two speakers that these issues are really important, but it's the NHS that can provide it if funded. Despite the findings of pandemic planning in 2017, the government ignored on the grounds of cost findings of totally inadequate personal protective equipment and intensive care capacity. And they created a crisis of 100,000 vacancies, including 40,000 nurses, and insufficient beds, the very points of pressure the NHS faced as COVID has spread. In January, we had 1/3 of the beds that Germany has. German hospitals have 6 times the capacity of intensive care beds, and Germany has 50% more doctors and many more nurses. And the public health system that is locally based, well-funded and able to run an effective test, trace and isolate system and feed into a national plan. I agree with the second speaker that Germany has a good health system, but it is private insurance. The costs are up front when you have to go and see a doctor. Insurance costs rise, and the cost of running the health service is significantly more than the UK. And if we have the funding available for healthcare that Germany spends, we would have £30 billion a year more. By March, the NHS responded magnificently, but the scandal of under-providing PPE was responsible for what turned out to be over 600 deaths of frontline health and care workers, a political failure, not an NHS failure. Yet the government continued its obsession to privatise, and instead of working with the NHS, local authorities and universities, bypassed them all, promoted the outsourcing of contracts to the private sector. The panicking government once again failed the public sector and has poured over £8 billion into the private sector for testing and contact tracing. One example, they gave a £108 million contract for PPE to a pest control company, a company that truly went from rats to riches. They outsourced testing to Deloitte and G4S and failed. They outsourced contact tracing to Serco in Seattle and failed. They abandoned the care home sector. 20,000 deaths have occurred there. Domiciliary home-based care is privatized and run on zero-hour contracts. There have been 3,600 excess deaths there. Past governments have redefined health needs like dementia as social care, and then subjected ill elderly people to means-tested private sector care, and they've had to pay for it, unlike in Scotland. There is so much evidence of the failures of privatisation, from the outrageous costs to the public purse of private finance-built hospitals, to the bankruptcy of Carillion, one of the largest outsourced service providers. And to the second speaker, I say that outsourcing healthcare has failed the NHS time and time again. Think of COVID and learn this lesson. We need now to return to the social morality that puts public health before private wealth. We need to praise and nurture the spirit of public service above private self-interest. We need to return to sound economics. Not many people know this, but if we invest in a strong health system that supports the public's health, the IMF says you will get a fourfold return on investment and underpin a strong society and economy. We need to restore the founding principles of the NHS and underlined by Nye Bevan, and deliver a health service that is responsible for the public's health, for prevention of illness, promoting well-being, for the health of mothers and babies, for the treatment of illness for both physical and mental needs, for all the UK, free at the point of use, as a right from the cradle to the grave. When it's publicly funded well, it succeeds more than any other system in the world. And I move that this proposition should be defeated, and we should go further and have a social care system that's run along the lines of the NHS. Thank you.
Thank you, member of the opposition, for that wonderful speech. And this concludes the end of the debate phase. Now, I would now open the floor to the general public, and I would start relaying questions that people have left for any particular speaker. So starting first, this is to the proposition. Recently, Serco has been outsourced for the recent COVID-19 track and trace system, which have ultimately failed. Do you think that this is more is what is related to your idea of outsourcing NHS services for much more efficient quality of service through private companies? Do you think that Serco is a standard case in this scenario?
I would respond to that by saying that we are in exceptional circumstances. Nothing about our health services that we are offering right now is standard. Nightingale hospitals are not standard. The need to implement an entirely new track and trace system is not standard, and distribute it to the millions of people that live in this country is not standard. So, as I said earlier, to go into the logistics of this privatisation plan requires that we allow it through Parliament. We allow it to be discussed by the right and the left and go into the details that would serve everybody. So I think in the instance of Serco, there's already dispute about their involvement with the COVID-19 test and trace app, because they're not actually listed under any official development contracts. So yes, in response to that, I'd say it can't be named as standard, nothing can be. Hence in my argument, I was sure to refer to 2019 and prior, before things really changed for our healthcare system.
Could I possibly come in and, comment to what Catherine said?
I'm happy to.
I would say that, the idea that we are in exceptional times is true, and I take that point. But you must understand, we're in exceptional times, but we're no exception. You know, the UK should be compared across the board to other nations, European nations, for example, even nations in the Far East like South Korea. We have completely failed in our pandemic response, precisely because of the privatization agenda. Serco has failed, Cital has failed. You must understand that. You know, even in Germany, which you hail as this pariah of private health, they have used a publicly funded local public health teams, devolved powers to the regions, and they have not had this reliance on the private sector like we have. It's precisely why we have completely bombed this pandemic response. And we failed many of those 10,000 people, tens of thousands of people that died. We had the highest excess deaths in the entirety of Europe. You know, at one point we were contact tracing less than 60% of close contacts of those that tested positive for the COVID, positive for COVID. And then, you know, even at the very best of times, 1 in 5 people were missed out in terms of contact tracing as well. That's 1 in 5 positive COVID cases out there walking around if they are asymptomatic, not isolating because of the awful failings of Serco and Cital. You know, these are private companies that we've brought in as our savior, and actually we've done a great disservice, and I would say a great crime to those that have lost loved ones through this reckless incompetence. We have public health teams that are doing an amazing job out there, that are contact tracing 95% of positive cases, and I think 90% of close contacts of these, and they are not being utilized in favor of this awful private company.
May I
that,
the opposition?
Yes, go on, yes.
Yes. During your argument, you outlined the UK as unique in its offering of universal healthcare, and you also made a further claim about us being acclaimed on a national stage for how we have responded to this, when in fact, if you look at privatized healthcare systems, like the one I referenced in Canada, I appreciate my teammate referenced Germany, but if you look at Canada, compare their response to ours, and I tell you, it is significantly more efficient, because by being thorough in our structure and allowing for integration of privatized healthcare, they had more money set aside for emergency services, which could be better distributed in these exceptional circumstances. The NHS needs to be protected, but I say that what we define the NHS as is what needs to move forward. I'm on the side of adequate healthcare for all British people. We're all medics here, we're all people here. We all want to see that continue and see the United Kingdom be exceptional in that regard. But I think what we're failing in is continuing this tussle between, are we publicly funded, are we privately funded? What we need is consistency, and then our responses can improve. I think we argue the same, two sides of the same coin.
I don't think, in all respect, sorry, I don't think we do argue two sides of the same, but I appreciate, you know, our outlook is the same. We want good healthcare for everyone, and I am in deep appreciation of your argument and the fact that you do want that outcome. But you must understand, when you say Canada had, you know, enough money set aside, I just can't buy into that. You know, with the NHS, out of the entire G7 countries, we spend the least per capita. We should have the most amount of money set aside. This isn't a failing of the NHS, it's a political failing, as Tony rightfully outlined. One thing I often say, and I think it outlines the point quite nicely, is that the NHS is not failing, it is being failed. It is being underfunded. You know, at one point in our polls, back in 2010, before this awful austerity agenda came in, back in 2010, the NHS would rank as, you know, very satisfactory, you know, high satisfaction rates in polls. People were happy with the care they received. And, you know, I think people in our generation don't quite appreciate that, because we don't remember it. We have no knowledge of it. But it's not the NHS that's failing. It is being failed by our political leadership.
So I suppose we agree in the respect that this needs further discussion in Parliament so that politics ceases to be the NHS.
Absolutely. I just don't believe that the way forward is through privatisation. I think it's you know, stopping this awful privatisation agenda and going back to a solid public base. You know, the most influential paper that I've ever read is by Nina Modi, and she suggested that a publicly funded, publicly provided NHS is the best way forward, and this is a giant in the field of healthcare.
I'd love to respond, but I think our moderator.
Yeah. Well,
Okay.
first of all, I think that this type of engagement is nonetheless very healthy to the wider discussion. And I would like to thank Charlotte and Jatinder for your contributions towards this question. Now, I'd like to go on to another question. This is for the opposition. So currently, when we hear about the government control in the NHS, this mainly involves divesting more money for hospitals to buy more equipment and to improve their services, etc. But do you think that now is the time that we try to take a novel approach, such as reducing the fees for local student nurses or reducing the fees for medics in our local university, rather than giving large sums of money to hospitals, given that right now, in the current situation, giving large sums of money is definitely going to come under large scrutiny. So I would like to give this question to the opposition.
May I take that, please? Well, first of all, I agree with the sentiment of the question in part, but it isn't really a novel idea to make cheaper the cost of training nurses and doctors. I think the student fees should be abolished in my own view, but this government took the political choice to remove the bursary from NHS students, and that's not just nurses, but it's also therapists, for example. And that was a political decision. And this theme underlies a lot of our discussion here, because it's easy to take the messages from the media, from whether it's the Daily Mail or whether it's out of the government's mouth, that there's no money tree and there's not enough money. But there is money galore when the government chooses to spend it in a certain way. I've said that £11 billion was suddenly found to give to private companies in the middle of the COVID pandemic. And they're planning £100 billion more on Operation Moonshot, which you may have heard of. Real squandering of public money, when if they concentrated on using the resources, albeit that they've actually weakened, but the resources of the NHS, local government, primary care and public health, who were screaming to be allowed access to the test and trace system. And if they put some of that money into local government and the NHS, we would have come out with that much better. So it is not true to say there is not enough money. And it isn't true to say that the NHS is the bottomless pit, which some people say. Jatinder made this point already, that if you compare it with spending per head of the population, for example, one of the reasons Switzerland, with its social health insurance model, has very good cancer care, one of the reasons is that the spend per person is double what the UK spends on healthcare in this country. And if we had double the amount of money, I can tell you that our cancer care would be a lot better. And it was up to 2010 that we were gaining in all these areas of increasing mortality from heart attack, better care and increasing recovery from cancer, shorter waits for elective procedures, much shorter waits in A&E. And it was a very, very functional health service that was democratically accessible to all. So there is enough money if we make the political choice. But I do not sit here saying that other health systems in Europe are rubbish. I would say that there are flaws in them, but they offer very good healthcare for most people. But if you're a relatively poor family in the Netherlands and you go to the doctor, you have to pay at least €12 up front to see that doctor. And if you're paying insurance, that insurance can be increased over time. and the costs of healthcare increase to the point where you may struggle. Switzerland, as I say, has double the funding, and so too in France and Germany. So I also feel that access to things like disability, mental health, rehabilitation services, they aren't equal across the whole of Europe. And when the NHS was properly funded and wasn't under attack ideologically, it was functioning as the best major system for a major health economy in the world. And that's not me saying that, that's the Commonwealth Fund saying that time and time again. So that's why I was saying that most of our viewers here are of an age where they haven't seen a time when the NHS was properly funded and respected and valued. And I want to go back to that position, and that's what our opposition to this motion contains.
Thank you, Tony. Would the proposition like to respond to that or contribute to that point?
I think as far as your argument's concerned, it's a very idealistic view to say that we can go back to those sort of golden days of the NHS when it was implemented, but we have to be honest and reflective on the state of our country and how we've progressed. The NHS was implemented under a Labour government, and since then we have seen a serious sort of international move towards more right-wing values. It was implemented after World War II. Just look at the changes in healthcare annually, look at the changes in technology annually. Our funding, I agree that our funding needs to be readdressed, but I also think it needs to be in line with our values. And our values remain that people deserve universal free healthcare, but I will stand firm on the principle that by integrating with private companies, their competition, which is a great deal of concern, and that prices will gradually rise. Their competition between companies, there will be an incentive to drive prices down, and the incentive of the British people wanting lower prices and therefore more susceptible to investment will incentivize them to drive prices down. And I understand my view is also idealistic, but as I've reiterated several times, these logistics can be discussed if we allow this idea to pass through Parliament. And I think with our modern state of our NHS, it's about time that we consider that privatisation. Because people, yes, years ago they were saying they were happy with their healthcare, but now they're not. Now with our modern technologies, higher death rates, and also increasing life expectancy outside of COVID-19, comparably with the rest of the world, we need to reform our ideas. But we want to hold on to our NHS. We just need to redefine what our NHS is.
Thank you. Thank you. Can I just come back on that briefly?
Yes.
I think that one huge flaw in the argument about privatisation is that our bodies are not cars. You can't compete to have a lower cost like you can to go to a different company to buy a cheaper car, unless you're actually willing to have the mortality and the morbidity associated with denial of care for those that can't afford it. Under Thatcher and Major, and indeed Tony Blair, the market was brought in more and more to drive efficiency into the NHS. And what it's done is explode bureaucracy. The costs before the market in the NHS were about 5% of annual NHS funding, and now they're between 15 and 20%. And when you have naked capitalism in the health market in America, it's 35% of running costs are spent on chasing money around the system. So I think we do need a splash of idealism. They're not new ideas, they're old ideas that healthcare is a right. Universal access to healthcare is also a right. We should not exclude people because of the color of their skin or because they're migrants. We can afford it, and we know we can afford it because we pay less per capita than most of the advanced, well, all of the advanced nations of the world, in fact. We know that you're right to say that the cost of healthcare has increased, and it's on average, it's about 4% per year. The increased funding for the health service has needed since 1950. But since 2010, the Conservative government reversed that. Now, so take on board, first of all, we spend less in this country than other countries on healthcare. We spend less, and therefore it's a political choice to be spending less. And secondly, when we were spending 4% per annum uplift for the NHS, we'd got to the point in 2009 when the NHS was the envy of the world.
Mm.
I'd just like, okay, sorry, do you want to have this or not?
I'll just be quite brief. I wouldn't pretend to condone our government's treatment of our healthcare services, and I think this COVID-19 pandemic has exposed that we do have the money to distribute into healthcare. I just think it needs to be distributed, and it needs to be distributed soon. You've got a lot of critiques for the American healthcare system, but I should reiterate the point. I also have great issue with the American healthcare system. I don't want to see anybody excluded. So I propose privatization where healthcare is free at the point of care. And yes, this means new systems need to be put in place for those who can't afford to work, etc. And we need to have new provisions for those people. But I would not introduce a privatized healthcare service that requires the poorest in our country to fork out for basic GP visits for their child. I just think when they do get the time to take their child to the GP, they shouldn't have to wait 3 hours. Thank you.
I just wanted to bring in the point actually that the proponents mentioned. They said actually that privatizing the NHS will drive down costs through market competition. Well, I mean, I want to bring in the point here. I think you have to understand market economics quite well. And I don't claim to, I'm not an economist, but the principal agent theory states that if an organization is contracted to be self-interested and to make and generate a profit, and therefore it is motivated to shirk its obligations to the state under its contract. So one thing that we will see if we bring in these private companies is that there will be an increase in fraudulent activity, actually. So currently in the UK, we spend on average about 5.59% of our total health expenditure on fraud, which is about £3.35 billion that's lost. But if you compare this to Canada, for example, they shelled out $34 billion in health claims last year. You know, these organizations, these private companies are not, you know, they're not the messiahs that you make them out to be. It just isn't possible. And, you know, a lot of these private firms that you want to invite into our market are companies with a history of fraudulent activity in the US. I mean, you could check this all out, it's online. And these are the type of companies that want a stake in our NHS, a stake in our healthcare. There's no accountability. They're most of them from the US. They have an international base. There is just no accountability. And the other aspect is that these organizations, these private companies, know so much more than the patient. The healthcare provider knows so much more than the patient, that you have this inequality, this mismatch between the two, and you just cannot introduce these awful companies into our markets and expect them to, you know, act in the best interest and drive down costs through competition, because it has shown to consistently fail over and over and over again. Yeah.
Well, that was a lovely contribution from all sides of the debate. Nell, would you like to respond to the point?
I'm sorry, I'm actually having some connection thing. His voice was breaking a little bit, so what I will say,
would you like to put some input into the discussion we were having?
I don't think I
can't hear you. Okay.
Can you hear me now?
Yep, we can hear you.
Right. Yeah, so I think what Charlotte and I are both, we both do agree with the fact that we do need universal healthcare that is free at the point of cost. And I think I am, again, also not an economist, so I wouldn't be able to say too much about that. But what I do, I'm sorry, yes. So I do think that there needs to be more of a discussion about how the competition would actually be affected and whether that would bring the prices down or not. But as Charlotte said again, that this needs to be passed through Parliament for that to happen. And also there has to be some government regulation, as is the case in some countries, where even the privatization, even like private companies, they have some legal duties that the government instills onto them. So.
Right. Okay. Oh, yep. Would you like to respond, Tony?
Yes, please. Can I just say that the notion of driving the price down is something that we just do not need in the health system. The price of a hip, for example, or the price of an operation or procedure was created under the Tony Blair years of the internal market in order to prepare the health service for going to the external market. So prior to that, there wasn't a notion of price and driving the price down. So you had two things. We didn't have prices. You had a funded health service that was expected then to get on with caring for the people that came through its door, and including preventative care and public health measures. And the cost of that was funded by a political decision of the government. And as Charlotte and Neil have said, that different governments have decided to invest more or less in the NHS, and it's usually the Labour government over time that has invested a lot more. We only need the concept of price when you introduce the market and you expect competition to be looking for patients to treat and make money out of them. And that is the abhorrent aspect that we just do not want. And we want to return to a national health service that's funded properly by the government and then allowed to get on and do its job and stop wasting money artificially trying to create prices, compete for prices, and compete with local hospitals or other health systems when you need to cooperate and not to compete. Can I just say that there's been many references to Canada, and I'm not sure if everybody knows this, but the Canadian hospital system is a public health system. It's not, private practice is not allowed in the Canadian public health system, in the Canadian hospital care system. And there's a good system of healthcare in Canada, and the 350 million people in America look at it enviously and see completely outrageous price costs in America that are not reflected in Canada. So there are good things and bad things in different systems around the world. I think we're all agreed that America is the most naked, exploitative example of private healthcare. But what we're saying is that private healthcare contradicts the concept that people can universally access healthcare without the freedom, with the freedom of, without the fear of having to pay for that healthcare. And of course, our healthcare isn't free. It's paid for democratically by a progressive taxation system and from public funding. And that is how you have the most democratic arrangement for a public health system, removing the bureaucratic costs of a social insurance system.
Well, thank you everyone for contributing to that question. If anyone has any other questions, and if you would prefer to say the question out loud now, you could just unmute your mics and just maybe within 15 seconds, try to present your question.
I saw a couple earlier during the debate. So there was one from
Right. So it's like a stanza. So the problem with this approach as an argument is that private companies' primary motivation is profit. They are beholden to shareholders, not patients, and therefore cut corners in providing care. So the patient inevitably suffers. I agree the NHS is not in good shape, but it needs sufficient funding, not privatization. And studies show that a well-funded healthcare system makes for a healthy economy. Do you think in a proposition that is always the case, that a healthy society would always lead to a healthy economy?
I think it's quite easy in privatisation debates to feel quite polarised in either direction. So it's easy to argue the side of, if I wanted to be a naive child in this, saying, no, all of these companies are good, they're compassionate, they put compassion before commission, as Jatinder argued earlier. But there's also the other polarised end, that these are all money-eating corporates that have no care for the individual layperson. And I think it's difficult, as Tony has also weighed in, I'm very young, I'm 18 years old, I've never seen the NHS when it was ideally funded, so perhaps my values are more in line with what I see proposed nowadays and what I see promoted in my inner circles. So I think it's difficult to weigh in on that question, saying that their motivation is only for shareholders and for profits, because in my ideal world, the companies that would enter into work in the healthcare sector would be compassionate healthcare workers who just want to see a better service provided within the NHS. Because as it stands today, there are actually a lot of private companies. I'm not sure if people are aware of this. A friend of mine went to go and get cancer treatment from a private provider, but she wasn't able to get her chemotherapy by her deadline due to the fact that private hospitals have been covering the NHS backlog. So you've got two ends of the spectrum. Yes, you've got Serco, who are easily interpreted as money-grabbing corporates, but you have also got private companies that are currently covering the NHS's back. I'm asking for consistency, and I think allowing the notion of privatisation to go through Parliament allows for that consistency, instead of this high-level deception we're seeing currently with some people who can afford private care being able to step up and get in front of the queue, and other people who can't afford it seeing this as some intimidating American capitalist code word whenever privatization comes up in the media. So yes, I think patients are suffering inevitably. Either way we're looking at this, the NHS is inadequately funded right now. So if we don't readdress it, they'll continue suffering. But if we go for complete privatizations, they suffer at that end too. I'm just asking for a better discussion. And I think proposing the notion of privatisation is the way forward in that discussion.
I
would like to add a question further to Charlotte. So are you saying that, because currently I'm getting two different types of models of privatization. One is expanding the current privatized industry, such as setting up more privatized hospitals rather than actually cutting off NHS services to hospitals. So just to clarify, is that what your perception of privatization means? Such as that there's a parallel model rather than complete dissemination?
Yes, so I'm not asking for abolishment of the NHS, because that would be an idiotic proposal in the United Kingdom. I would be ignoring the democratic wishes of our nation to propose that. But what I am asking for is the type of privatisation that provides free healthcare at the point of care. So as Tony said, in Canada, the system is that hospitals remain public. That is the point of care where people cannot be affording to pay up front. If you break your leg, you can't be affording to spend thousands right then and there, purely based on accident. So I'm saying that these two systems should be parallel, and I'm saying that more detail should be considered on what this private side is doing, because at the moment, I'd say for me as an 18-year-old, I pay a lot of attention to politics, and the word privatisation seems to be not stigmatized, but it's a real buzzword for people now, and it gets people nervous and it gets people scared. It gets diabetics wondering if they can still afford their insulin. It gets cancer patients wondering if they're going to have to pay for chemo. It's worrying people, and I think we need to see these parallel systems openly discussed in equity.
Could I possibly come in here?
Absolutely.
I wanted to say, Charlotte, that that was a powerful anecdote that you used about your friend, and I'm ever so sorry to hear that. And I think it speaks volumes that we do need to improve care in the UK, hospital care, and people need to get cancer care much faster. But you used the point about that you wish for these companies to be compassionate, and that might be an idealistic perspective, like you mentioned, and understandably so. But I thought I'll just give a few scenarios here of some of the companies that do want an interest in our healthcare markets. I have to put that in quotation marks. One of these companies is United Health. So throughout 2000 to 2009, they paid 2.9 million in, and then 50 million, and then 350 million to settle actions against non-payments. And then you have McKesson, again, another US company that committed fraudulent activity and shirked their obligations. Then you have Etana, another US company that wants a stake in our markets and again broke their contract obligations. And then finally you have HCA, which is another company, and even GlaxoSmithKline, which is I appreciate a local company that also shirked obligations. These companies cannot be trusted. When a company and a big private organization has such a large base across borders, and they are very much an internationally established organization, they have massive lobbying power and zero accountability. And they are motivated to shirk their obligations. They are not going to act in the best interest of you and I. And to think otherwise would just be, it would be ludicrous. It's not public healthcare in the way that we know it. And I think that's the big problem here. You just cannot trust these companies with health. Healthcare, it's different from, I don't know, buying a laptop from Samsung versus Apple, for example, because we have a good understanding of both companies. We have an understanding of the product. But to say that a patient has an understanding of complex medical procedures and what they need it's just not the same. It's not a comparable aspect. Healthcare is very unique in that perspective, and that's why it should not be marketized.
Well, that's a very interesting point. Tony, would you like to contribute, or Nell, would you also like to contribute to the discussion?
Yes, but Nell might want to come first.
No, I'll let you go first.
All right, thank you. Well, I wanted to say a couple of things. Some of us are doctors or students and wanting to become doctors are involved in healthcare. One of the huge lessons that we have to learn is to always not just observe things, but ask why something's happening. And if, as Charlotte says, that private hospitals are covering the NHS in COVID, we have to ask why. And the reason is that the NHS has been stripped down to the very bone for political reasons by a government that has not sought to invest in the NHS, but has sought to bolster the private sector. Now, I don't want to turn that into necessarily a moral issue. I think economically also it doesn't make sense. But in terms of public health, it absolutely doesn't make sense. And they've cut the number, and this is successive governments, by the way, it isn't just a Conservative government. They've cut the NHS beds right down to the minimum, so that there's less than 100,000 when there used to be over 150,000, 10 or 15 years ago in the acute sector. And at a point of public crisis, there is no leeway. So bed occupancy needs to be around 85% to be safe. And in parts of the country, even in the summer, it's more than 90%. And so we were entering a unique crisis. And of course, you have to accept that it is a unique crisis, but you enter a unique crisis with a damaged health service and other systems like social care, damaged by political ideology, I'm afraid. And even more so than in Germany, which is a capitalist country with social insurance model, but they respected their health system far more than the ideologues in charge of our government, successively, I'm afraid. So we have simply not enough beds, not enough staff. And there's an important, well, my second point here, and then I'll shut up. The point about privatizing healthcare means that you fragment the health system into potentially hundreds of different companies running different aspects of the health service. And what you've done is you've divided the workforce, taken them in, at the moment, hundreds of thousands of people that used to work for the NHS are now in outsourced companies. And they no longer have the terms and conditions of health staff, and they no longer have the pride of working for the public good, for a public health service. And I know that a lot of those people are actually Black and Asian minority ethnic people who are in outsourced companies precisely because their wages can be driven down. So one of the key issues about 100,000 vacancies is that the government hasn't trained enough staff, have failed in planning the workforce, but at the same time, they're driving hundreds of thousands of people out of the NHS and out of that team spirit, and they're driving the cost of wages down, and that's hitting the most vulnerable of the population. So one of the really important aspects of the NHS has been the morale for staff, proud, and there's something like 1.4 million people working, many of them part-time, 1.4 million people working for the NHS. Part of the success of it has been when you have the pride of working for the public good, and that's certainly what brought me into medicine and wanting me to work as a community paediatrician. And I think we ignore that at our peril, and privatization fragments and divides. So that's what I sincerely want us to avoid.
Well, thank you, Tony. Nell, do you have anything to add to what Tony has said?
Well, not to what Tony has said now, but I actually want to refer back to the initial question. Was that about private healthcare and insurance?
So it's the parallel coexistence of a growing privatized sector alongside a public NHS. That was the original question, but yeah.
Yeah, that is what I wanted to just address, just add on to what Charlotte said about that. So the only part I want to cover, to point out, is that there are a lot of treatments and technologies that the NHS cannot afford, and that is based on cost effectiveness and stuff, which are studies conducted by NICE and recommendations given by NICE in that regard. So in those treatments, the NHS just simply rejects them, and patients can't receive those. And for patients where it becomes a matter of life or death, where no other treatments work for them, or where they just don't qualify to receive that treatment, private healthcare is the only place for them to turn. So again, regarding the parallel, it needs to exist in some way so that everyone can actually access the care they need.
Could I possibly respond to that point?
Yeah, please.
Yeah, so I wanted to make this distinction, and I think it's very, very important that we all make this distinction, is actually, asking the question why, and I think Tony touched upon this very nicely, is asking the point why. Why can the NHS not afford these various different treatments and this new technology that you mentioned? I mean, it's the most efficient healthcare system in the entirety of the G7. So, ask the question why. Is it because of the healthcare system, or is it because of political choice and political failings? Now, I mean, if you look at the numbers, if you crunch them all down, it seems to be a political failing that the NHS has been chronically underfunded, understaffed, and underprivileged for the past 10 years. And we need to make that distinction. I think to collude the two is simply, I don't know, it's simply not, it wouldn't be the correct way of going about it. You really have to analyze it. In terms of a parallel system as well. So, one of the arguments I made in my speech was that actually, that these private companies often cherry pick the very straightforward, routine, easy cases. And then this just isn't specific to maternity services. This is across the whole thing. I just picked maternity services because it was quite a good example to explain the moralistic perspective. And the CQC has even mentioned that this has a destabilizing effect on the NHS. This has a detrimental impact. And again, if you look at healthcare systems in Brazil and Bolivia, I think, very different countries to ours, and very different to the G7. But what you see is that the private healthcare sector sucks in the resources, sucks in the profit and the staffing as well, leaving the burden on the public sector. So to say that they should exist and coexist is ludicrous in my mind. I mean, the language of science is data, and the data from other countries, the data from other healthcare systems is screaming at us to not follow this model. The whole world, even the US, is coming more towards us, funding healthcare through taxation. We should not be going the other way. We should not be the outlier here. We should not be the exception again, would be my perspective on this.
Can I just pose just a question? So is that okay?
Sorry, Nell. I think that now I would probably ask one last question in order to end the discussion phase, in order to, if you have a closing statement you would like to present to the audience, that'd be great. But I think this question, Nell, you would also like to answer too. And I want to ask both sides of the bench, what lies in the future in your scenario, and what is the ultimate end goal? What is the ultimate end goal in terms of what privatization would look like, or what in the current status quo can be improved without privatization in the future? So I think this will be a very good question to lead up to our closing statements.
I think we all have the same end goal in mind, which is better distribution of government funding to provide the optimum healthcare services that we can to the people of the United Kingdom. In my ideal world, I've seen in the chat that people are saying corporate companies aren't doing this out of the good of their hearts, and that's understandable, but the government is investing in them, and the healthcare they're providing is adequate and it is sufficient to keep people alive and to keep people safe, healthy and well. That would be my ideal circumstance. Personally, I think it's consequence, not cause, which matters more. I think it matters more that at the point of care, people aren't being put out of pocket, they're not being put in harm's way, and they're being given the best care they can. I don't think it matters what happens at the corporate end, as long as that is maintained. And that's of course idealistic, and of course it means fragmenting partially the public healthcare system we currently have, but we have to admit it's fragmented already. The system we currently have is falling apart, and people are falling into these corporate pockets, and then that's not instituted by our government. People are just doing it because they're seeing that people in America are getting the healthcare they want when they fork out their money, and people are trying to replicate that to keep themselves healthy and well. My ideal circumstance would be that it remains free, that the NHS remains intact, but in a new form. Thank you.
Well, thank you, Charlotte. Any speaker from the opposition bench who would like to respond to that? Tony?
Oh, Tony, you're muted.
Tony, I don't think you're unmuted.
Yeah, you're on mute.
Very sorry, big school child's error. I appreciate Charlotte's sentiments there, and there's a lot of ambition that we have for the public and for the NHS that we share, I'm sure. I can't agree with your statement that the consequences are more important than the cause. Certainly, as a doctor, you need to know the cause of lung cancer in order to stop the consequences happening and not just treat the consequences. And I know you'd probably agree with that, but the cause that I'm worried about is why the NHS is underperforming, and the cause is political neglect and an ideology that goes away from publicly funding services, including education and social care, I have to say, not to mention water and travel. You know, in other countries, these are seen as the crown jewels of the country, that they need to be looked after and owned by the public purse and run by the government. And I think that's what I want. And in response to the moderator's question, the things that I want are better funding, but not extraordinary funding that is in line with other major countries. And if we got up to that level, if we got up to the level of France and Germany and Switzerland, we would be able to afford so many things that we don't have at the moment. We need to root out the waste of privatization. I was telling you that the introduction of the market, because we're talking about the House would privatize the National Health Service, but the problem is privatization has already been brought in to the National Health Service to a significant degree. You know, 7.1% of clinical services are outsourced to private contracts. There's dentistry, opticians are sometimes harder to get because people can't afford it. Dentistry is a prime example, people pulling their own teeth out. There's privatization of buildings, there's privatizations of pathology. Privatization is encircling the NHS. And what we know is that the cost of the market has gone up from 5% of annual funding to 15 to 20%. And 20% of a budget of 140 million is, what is it? 28 billion pounds a year. Now, so I want to root out the waste of privatization. I want to restore student bursaries so that nurses and therapists are encouraged to come into the health service. I would love to get rid of student fees altogether. I want to train enough staff so that they're not demoralized and exhausted. And we need to invest in healthcare, which we could afford if we were funded on a comparable level with France or Germany, for example, and repair our ailing buildings, restore staff morale, get rid of the waiting lists, and also plan for circumstances like a pandemic. And in 2017, the government had an exercise to plan for pandemics, Operation Cygnus. They found a total inadequate supply of PPE, a lack of eye masks to protect them, a total inadequate number of intensive care beds, and they were worrying about the overall number of beds and staff available. And Jeremy Hunt, who was the Secretary of State, ignored all of those findings, and he just didn't let it drop, and it was a question of cost. Now, if you put health first above cost, we would have prepared for a pandemic from 2017 onwards, and we should have done. And actually, it's a disgrace that we haven't done that. And it's a disgrace that we haven't learned even since the failings of February and March, when they abandoned contact tracing. And they abandoned it in order to pursue privatization through outsourcing. So I agree with Charlotte saying that just because a private company exists doesn't make it full of evil people. But the track record is that this government is being absolutely irresponsible in flooding money out of the NHS and out of the economy to a system that has failed. And there's all sorts of failures of private companies, including the failure to clean children's wards in Leicester, rats in kitchens in Nottingham and Leicester, Carillion losing contracts. There's all sorts of things where, in order for a private company to make a profit, which is actually its purpose in life, it has to cut corners. And if you cut corners in health, you damage the health of the system and endanger people's lives.
Well, I would like to thank both sides of the bench for those wonderful speeches. I'm sure that if this public debate was live, everyone would be giving a round of applause. So giving a round of applause for ourselves. Would any bench like to provide a closing remark? Just a 1 or 2 sentence closing remark? It's completely optional.
I feel we've given a lot of our
Oh,
statements within the questioning
right.
about 4 times each. So I think the audience would probably just hit their heads against the table if
Yeah.
we did it, but I'm open to the opposition providing closing statements.
Yeah, I'll be honest, I never shut up, so I'm more than happy to give a closing remark as quick as I can. You know, I think we mustn't lose sight of the fact that what we do have is a marvelous system, even though it's operating within vicarious factors, political factors, socioeconomic factors that really do constrain its ability to flourish. We mustn't lose fact of this incredible health service that we do have. And I think we must fight to protect it. And we must keep in mind, not just ideology, but evidence from across the world that shows our NHS is the best healthcare system out there in terms of cost, affordability, access, equality, administrative costs and access. And yeah, I sometimes fear that we do lose sight of this, and we might find ourselves in a couple of years down the line looking back and thinking, oh crap, what have we lost? You know? And I think that's my closing remarks, rather somber and a reminder that we must value this incredible service that we have.
Of course, and I will give a very short closing remark that I agree the NHS is something to be treasured and valued, and I think our government should reflect that.
Well, I would like to thank both all speakers from the proposition and the opposition, namely Charlotte, Jatinder, Nell, and Tony. And before we end this debate, I would like to remind the audience that no matter whether or not you are predispositioned, you have a opinion before this debate, whether or not you approve of privatization or not, I think that this debate has definitely demonstrated that even within our society and during these times that we can have a very healthy discussion. And I do think that in this debate, both sides have exchanged very thoughtful analysis, very thoughtful arguments, and I'm sure that both sides have their very robust reasons for having those opinions. And I think being able to see this, especially to the wider public, is a great service to democracy. And overall, I feel very proud of how we progressed today. So first, I would like to, once again, thank you everyone for coming to the debate. If you would still like to chip into the fundraiser for Greater Manchester Mental Health NHS Trust, the link is somewhere in the Zoom chat. Likewise, it's also posted in the Facebook post. I hope everyone enjoyed the debate today. I certainly did. And I hope the speakers are also very proud of themselves, no matter what position they have during this debate. So thank you everyone so much for this wonderful debate today. I will release the recording of the debate later on today. It would be on the same event page. But once again, thank you so much for participating in this MDU debate. Thank you.
And thank you, Keaton, for being a wonderful moderator.
Yes, thank you.
Yeah.
I've really enjoyed that. Thank you.
It's
Even
very
if,
polite. Yeah.
Yeah, thank you, Kenton, and thank you too.
And thank you
all the speakers.
as well. You guys
Thank
gave
you.
it a thorough debate.
Thank you very much from me as well, Kenton. If you don't mind, could I just put the website for Keeper NHS Public in the chat? And
Yeah, sure.
I don't know if it's too late, but
Oh, it's absolutely fine. best to have it on record.
thank you.
Right. Well, thank you so much for Jatinder and Tony for speaking from Keep Our NHS Public. It is a very exciting opportunity to meet you. And thank you to the Medical Debating Society and the School of Biological Sciences for sending a representative, or at least very keen university students who are very interested in the contemporary issues we have right now. And after that, I would like to end this meeting. And thank you all so much. And I'll see you maybe in the next public debate.
Thank you ever so much.
Thank you so much. Thank you. Thank you. Thanks.
Thank you very much. Bye-bye.
Bye-bye.
Thank you. Thanks. Bye.
Good luck to everybody.
Good luck. Thank
Good
you.
luck, guys. Yeah.
Stay
I'll be
safe.
in touch with you soon about your